The development of Medicare, I would say, really has its roots actually in that pivotal moment in the 1940s when this effort to reform healthcare on a national level fails under Truman's administration. And this really ends up being a watershed. Around this same time, many other countries in the world are developing these sorts of national health insurance schemes or expanding existing ones. But the United States, this is the point where we really veer off on a totally different track. And after that failure under the Truman administration, which many people had seen as this is a great time to do it, it seemed that political groups were sort of lined up as they should be in order to pass some sort of sweeping legislation, but it doesn't happen. Those who favor more comprehensive changes to the healthcare system take a step back and they say, okay, well, if we can't enact something that is going to cover everyone on a national level, let's focus on some groups that really need it. And the elderly were one of these groups, which makes sense. Elderly are not working, so they're not going to be covered by employment-based healthcare systems. They often have some of the highest rates of needing care, understandably, again. And they have sort of the least income in order to actually pay for that care as these healthcare costs are rising. So this becomes a targeted group to say, let's develop something at least to cover the elderly. In 1965, after a number of other attempts in between, Medicare ends up passing under the Johnson administration. Once again, a lot of organized medicine is against the idea of Medicare. Understandably for those who are against it. Those who were for Medicare generally saw it as a stepping stone to then slowly expand coverage further into a more universal option, as they had been trying to do for several decades. Those who were against it saw it as a stepping stone for government to slowly expand into a more universal coverage, which they were against.